In the name of Almighty Allah, so today we will discuss Mental Health Awareness Month. So every year, the month of May is celebrated as a Mental Health Awareness Month. This is actually initiative of World Health Organization along with the support of CDC and other international health bodies. So first of all, what is health? Health is the simplest definition is it is an emotional, psychological, and social well-being, and not just the absence of a disease or infirmity. So now the definition of mental health. So mental health includes our emotional, psychological, and social well-being. It also affects how we think, feel, and act. It also determines how we handle stress, relate to other people, and how we make a healthy choices. So mental health is an important issue, and it's important at every stage of life, ranging from childhood till adolescence and finally to adulthood, and the last stage is geriatric one. So in all these stages we have a need of a strong mental health followed by emotional, psychological, and social well-being. So if any one of them is lacking, so we must be sure that there is a pathology, there is a disease condition or abnormality or illness. Why is mental health important for overall health? So a healthy body have a healthy mind. So for physical health, mental health is paramount. So mental and physical health are equally important component of overall health. Example, depression increases the risk of many other type of physical health problems like diabetes, heart diseases, and even stroke. So physical health and mental health are intertwined. Now we will discuss about can your mental health change your time? So absolutely yes. If someone is working long hours, caring for relatives, or experiencing economic hardship, so they may experience poor mental health. So environmental factors, familial pressure followed by economic doldrums, so all these factors having influence on the mental health. So if these conditions are not up to the mark, so definitely the mental health will suffer. Now some other important points about mental health. Now I will discuss about how common are mental illnesses. So first of all, 1 in 5 United States citizens, especially in adults, are suffering from mental illnesses. So it's a alarming figure. About 1 in 25 USA adults lives with a serious mental illnesses such as schizophrenia, which is also called split personality, bipolar disorder, are major disorders. So it's also alarming because 1 in 5 and 1 in 25, so both conditions are quite abnormal and quite harmful. Now we will discuss about Pakistan. So according to World Health Organization WHO, 45.5 million people suffer from mental disorders in Pakistan. So this rate is also quite alarming. Or simply we can say that out of 100 people, so almost 34 persons are affected from mental illnesses. Now, what are the major contributing factors which are causing mental illnesses? So, the first one is adverse childhood experiences. There are many factors which are explaining that why childhood experiences affects on the later life. So I have studied psychology and I have learned that if someone is sexually abused in childhood, if there is a physical result on someone, or if there is a trauma like situation, or if a child having brought up in a war like situation. So all these factors having influence on the personality of a child, and these factors are then expressing in later stage of the life. So childhood experiences, genetic factors are also responsible for mental illnesses. Unfavorable social, economic, geopolitical, and environmental circumstances like poverty, violence, trauma, sexual abuse, uh, along with many other factors. Economic factors nowadays is one of the major factor, along with biological factor and psychological factors are also the contributing points behind mental illnesses. And harsh parenting and physical punishment or corporal punishment. So these factors are also the contributing factor behind mental illnesses. Use of alcohol or psychopathic drugs or psychoactive drugs, along with loneliness, which is one of the symptom of depression, or solitude, isolation, and many other factors. So all these are a few factors, but a major factor behind mental illnesses. Now some other points. Now I will just, there are more than 200 types of mental illnesses, but these points are especially relevant to my CSS syllabus and especially psychology subject, because I have opted psychology, and in PMS I have alhamdulillah scored 145 out of 200 in psychology. uh, for next attempt I have also opted this subject. So I have studied all these mental illnesses, disorders, and many type of test as for personality, emotion are concerned. So now I will discuss about types of mental illnesses. So the first one is psychoneurotic disorders. Another name is psychoneurosis. It is also a mental problem, mental disease. Next one is psychosomatic disorders, along with personality disorder, somatoform disorder, dissociative disorder, mood disorder, and schizophrenic disorder. As I have mentioned, that there are more than 200 types of mental illnesses, but I have discussed just a few. Now the main thing is treatment. So psychotherapies are very important for the treatment of mental illnesses, along with some precautionary measures. So the first one is psychoanalysis, which was developed by Sigmund Freud, which is called father of psychology, followed by psychoanalytic therapy, psychodynamic therapy, cognitive therapies, gestalt therapy, existential therapy, group psychotherapy, rational emotive behavior therapy, and CBT for drug addictions. There are many other psychotherapies which are used for different type of morbidities. As for mental illnesses or mental problems are concerned, now some prudent measures and ways to improve mental health. So first of all, it's the domain of a psychologist and psychiatrist. There is a difference between a psychologist and psychiatrist, because psychiatrists mostly are, their domain is to dispense and to prescribe medicines, but psychologists treat patients through his innovative and uh, through his tactics and through his knowledge and procedures. So one is pharmacological and other is non-pharmacological. So the first one is practice mindfulness, meditation, yoga, or the recitation of Holy Quran, because these things and stuff having influence on the psychology, on the mind, on the cognition, and on the mental health. Being a Muslim, so we should believe that. Next one is eat healthy food and try to avoid junk food, spicy food, or unhealthy food. Next one, there should be exercise for at least half an hour on daily basis. Practice a positive self-talk. So there should be optimism. There should be healthy and useful discussion. Next one is a patient or a person should do outing, should be in a gregarious mood. They should interact, communicate with other people. And the last one is consult psychologist and psychiatrist. So medications are also used for many of the above mentioned diseases. Now I have collected the above mentioned points and data from WHO website, World Health Organization, followed by Center for Disease Control and Prevention, which is CDC, and it is based in USA. And the WHO Mission Comprehensive Mental Health Action Plan, which has been started since 2013, and it will be completed till 2030. And it is also the part of SDGs, which is Sustainable Development Goal of the United Nations. So at the end, I will suggest from my side that the basic motto and the basic objective of Mental Health Awareness Month is to create awareness, to sensationalize a mental health issue, because in Pakistan, as I mentioned, 45.5 million people are under the reeling of mental illnesses, and we can say that mental illnesses are silent killer, because in Pakistan there is a paucity of psychologists, because there is a social stigma related to this issue, and most of the patients which are suffering, so they are unexpressive. And it is interesting that this issue is also as common in male in comparison to females. So there is an urgent need of to highlight mental problems, and we should not discriminate, we should not stigmatize those patients who are suffering from these maladies, because it's a biological factors are mostly responsible, because hormonal changes may happens, may there is problems occurs at the level of CNS, along with some environmental and surrounding factors. So we should not discriminate, we should not stigmatize these problems. We should be the part of community, we should play our constructive role, that we should make our society healthy, and we should make our beloved Pakistan a healthy, prosperous, developed nation. So thank you and best of luck, and may the blessing of God never cease upon you. Thank you.